Welcome to this podcast from the Journal of Child Psychiatry and Psychology. I am Joel Nigg, former review editor of the JCPP and professor of psychology, psychiatry, and behavioral neuroscience at Oregon Health and Science University. I'm delighted to be joined today by Professor Virginia Rauh, professor of population and family health at the Columbia University Medical Center, to discuss her recently published article, Environmental Exposures, Neurodevelopment, and Child Mental Health: New Paradigms for the Study of Brain and Behavioral Effects. Dr. Rauh, welcome. Thanks for joining us.
Thank you. Glad to be here.
In this article, you raise a number of very important points and some interesting controversies. And I wonder if we could just start by telling our listeners what's the most important kind of take-home message from this widely cited article.
Well, I think several take-home messages are embedded in this paper, and perhaps the first is that scientists are now aware of the extent of the developmental threats associated with certain environmental exposures. We know that these exposures are very real. They have documentable impact on the brain. We know that all children are vulnerable. And we know that the sensitivity and the vulnerability is greatest early on in utero and during the first few years of life, when some of these exposures to the neurotoxic elements are often higher.
Well, that sounds like very important information for our listeners, and I want to come back to that. But you mentioned what we've learned here about the brain. Can you tell us, you've been doing this studying environmental toxicants and children's health and development now for your entire career and been a leader in this area. What from your point of view, are the most important one or two things that we now know about this field that we did not know even a decade ago?
Well, we now know, as I noted, that the early exposures have very real effects on early brain development. It's not clear what the overall implications of all of these changes are, but we do have the tools now to examine these potentially worrisome changes in the brain. Some of these changes may be persistent, and some of these changes may have far-reaching behavioral and perhaps even clinical effects. I think, secondly, we know that there are literally thousands of new potentially toxic chemicals in the environment and on the market, the effects of which we actually do not yet know. And I would say another area in which there's been tremendous progress in the last decade or two is the understanding of the impact of socially toxic environments, so that now we know that the social environment is equally important in terms of early development and brain development, and that a high-quality home environment can have very real benefits, perhaps even protect the early developing brain.
Well, this brings us to the question of what this might mean for parents. But you mentioned that we're learning more about these exposures in the brain. Is this just for kids who've been poisoned by living next to a chemical factory, or are you talking about more general exposures throughout the population? I'm thinking in particular about these modest and yet concerning lead exposures all around the country right now. Are you telling us that these more or less average exposures are also important?
Well, I think that's a very good question. Certainly there are known neurotoxic exposures, and lead would be an excellent example of that, and certainly some of the organophosphate pesticides. But your question, before I answer, specifically address what parents should be concerned about. I think there are a number of new chemicals that have been introduced and developed, primarily synthetics, over the last decade or so, and we actually don't know what the long-term impact of these chemicals are, particularly if kids are exposed early on. So I would say that the possible exposure to potentially neurotoxic chemicals is widespread. Now, that does sound alarming to parents. I think that the message would be to be vigilant not overly anxious, but vigilant, especially during pregnancy and the early years. These are times when it would be appropriate to minimize exposures, maybe even take a look at some trusted websites to keep you informed about which foods, for example, may have the highest residue or may pose the highest risks. Perhaps try to avoid using sprays, both indoors and outside, in places where your children or other children are likely to congregate or play. But at the same time, I think it's important to recognize that this is not a message to avoid fresh fruits and vegetables or worry that breastfeeding, for example, is unsafe. The benefits of some of these healthy foods and breastfeeding are far outweigh, generally speaking, the risks posed by certainly pesticide exposures on foods that may be ingested by the mother or child. So I think that the message should be, rather than extreme anxiety, to increase your awareness, be vigilant, particularly during early developmental period when both mother and child, the developing child, may be particularly vulnerable.
So it sounds like you're saying that it really makes sense for parents to take seriously trying to avoid what they can as far as unnecessary chemical exposures to their children, like household cleaners and perhaps even some consumer products that have questionable amounts of chemicals in them, but that they should not go so far as to stop doing healthy things like fresh food and breastfeeding, regardless of the possibility that there's a little bit of contaminant there as well.
Yes, absolutely, because a good healthy diet, including fresh fruits and vegetables, is very protective and reduces risk for long-term chronic diseases.
Well, let's telescope out here. You're talking about some things that individual families or parents might want to do to protect their children from somewhat routine toxic exposures, or what we used to think were routine, that it sounds like you're telling us we should be concerned about some of these. Let's go back to this question of the lead crisis. This is spreading as we speak throughout the United States, and I don't know about other countries, where more and more school districts around the country now, I think a couple of dozen states are reporting high levels of lead in their school drinking water. And of course, this also exists in older homes as far as lead paint. And I know you mentioned that lead is just one of perhaps thousands of chemicals we should be worried about. But I know that many parents are concerned that they alone can't, for example, protect their child from unsafe water at school. What does society need to be doing about the risk of chemical contamination in our children's development now that we have so many chemicals out there?
Yes, well, this is very relevant in today's world, and the lead crisis, for example, is a very real threat to child health. Importantly, this is a type of exposure that it is difficult for individual families, parents to prevent or perhaps even be aware of. There are some ways of testing water in the home, for example, using commercially available home test kits and water filters. Some of these are somewhat expensive, so this is where we need to rely upon more effective public health monitoring. I think that it is the role of science in translating science into policy and practice to find cheaper, more affordable, and more accurate ways to identify risky water supplies, perhaps in schools, public places, and in water lines that serve private homes, so that the public health authorities can address the source of the problem. This is an example in public health where you may have a widespread problem that is very difficult to prevent from the perspective of individual families. So I think we do need a strong and vigilant regulatory system. Quite traditionally, the regulatory system and any kind of regulatory action tends to lag several years behind the science, so that families may feel that conditions are safe, whereas in reality there may be some risk associated with public exposures.
So it sounds like we really need to be informed as citizens. We can't rely on existing regulations to be sufficient, either because they aren't strong enough or because they're behind the science. And so we really have to inform ourselves and make our voices heard about this if we're worried about it. It sounds like is that a fair statement?
Yes, I would agree. The limitation here is that we need to empower our regulatory agencies with enough resources to do the job. At the moment in the United States, the Environmental Protection Agency is heavily burdened with a big backlog of regulation, and the need to stay on top of a whole range of new chemicals that are being introduced into the environment is a very serious burden. So we need to provide our public regulatory agencies with money and the tools to address the problems, and perhaps put this as more of a priority on the national agenda. And I think what you note about individual and public awareness is very important. We have to have, effective campaigns to improve information for the general public. We need to find better ways of minimizing the damage once it has occurred and identifying potential antidotes. For example, parents can always be encouraged to provide more stimulating environments at home, early preschool classes, every kind of intervention we can think of that encourages healthy parenting and optimal learning for kids to possibly overcome some of the possible consequences of early exposures that may have been unintentional or unavoidable.
You're saying then that even though we don't know for sure about all of this, that if parents are worried about toxic exposures that they can't avoid for their children, one thing they can do is give their child every other advantage in terms of social support and reducing the stress or social pressure, as well as healthy food and so on, that this might actually protect kids from the biological effects of the toxicants that they might be exposed to, at least if these are relatively modest exposures. Is that a fair reflection of what you're saying?
I think so. I think that the social environment and the kind of stimulation that children receive is equally as important as the chemical environment or other aspects of the built environment. And I think to the extent that we provide high-quality learning environments, that we stimulate children to have a healthy developmental trajectory, I think we are protecting the brain against potential toxic effects of chemicals, some of which are unseen or unknown at this point. And I would include in that, as we noted a few moments ago, access to healthy foods and a good diet. So the vigilance and the families need to maintain really is just to be rational and sensible about avoiding the toxic exposures that are already known. We're already known to cause difficulties, and to pursue a course that really encourages healthy learning and stimulation to try to protect that little brain that is still very vulnerable in the early years.
That's really helpful advice to kind of have a balanced view there. I noticed in your article that some of the papers you cited and some of the comments in the article that there's been ongoing concern in the scientific community that harms can occur at lower levels of exposure than were once thought for various chemicals. It's something there's a lot we still need to learn about these low exposures, and that this is no time to slow down on the research.
I absolutely agree with that. And in the case of lead, where the risk assessment and the regulatory standards have changed over the years, to advise consumers and to take lead levels out of various products at lower and lower levels. We've learned a lesson there. I think in the case of lead, most scientists would agree that lead exposure is unsafe at any level. So we have to continue working to assess the longer-term effects of some of these exposures, even at very, very minor levels.
Well, this is very helpful. It sure seems that many of our public officials are not aware of these concerns, and I know parents are hungry for more information. Are there trusted sources of information before we close that, aside from your article, which I will certainly encourage people to review, that parents can go to learn more?
Well, there are websites from the Centers for Disease Control, which will give you safe levels. The Environmental Protection Agency. These are government websites that have been carefully vetted and tend to be very consistent with the science. There are other consumer advocacy groups, of course, that may be providing information on how to up your organic vegetable and fruit and food consumption. These are all good sources of information. Again, sometimes eating with an organic idea is terrific, yet very expensive for the average consumer. So another option, of course, is to use your backyard garden and grow some of these fruits and vegetables for family consumption. Not all folks have an opportunity to do this or the place to do this, but there are lots of farmers markets and green grocers out there who are really trying to offer communities a safer source of food, and I think that any and all of these activities should be undertaken.
I also understand that there are, for our listeners, a number of public interest advocacy groups that monitor policy developments and regulatory developments in this area, that citizens and scientists alike that want to understand what's happening on the regulatory side have resources as well that are available with a little bit of digging.
I think so, and again, I would start with the government websites that have some of the science linked to the policy, and take it from there. Having said that, I think there's a lot of misinformation that's out there, and it is difficult for families to sift through. The message here is not to take away a lot of anxiety, but to from this type of reading material, but to actively be seeking out information and be vigilant. And I think I would stress again, as we noted in the very beginning, there are certain times in a child's life, both prenatally and during the early years, where the brain is particularly vulnerable and susceptible because it's developing rapidly. And these are the times when perhaps it's worthwhile to be most vigilant. So the take-home message there is for pregnant moms to try to avoid a whole range of toxic exposures in the environment, if at all possible. And that includes substances like environmental tobacco smoke. It's a time to think, perhaps put your resources toward having a more healthy environment to minimize the exposures. I think as children grow and develop, some susceptibility to a lot of these potentially toxic exposures does subside a bit. So it's really, I think, prudent to focus on being most careful, perhaps for the pregnant mom, and during the early years of life, when a child is very apt to be low to the ground, putting a lot of things into the mouth, and just to be as careful as possible in terms of safe play spaces during those early years. I think that's a very important principle.
Dr. Rauh, thank you so much for joining me today and for your very interesting insights about what we're learning in our science about the relationship of toxicant exposures, especially early in life with development of the brain in children. And you've certainly helped us to see that this is an area we need to pay more attention to. And I really thank you for your time and your expertise.
My pleasure. Thanks, Dr. Nigg.